HIV and AIDS, human immune deficiency virus. This is a virus that produces decrease in the immunity of the human body. And the end result of this process of the retrovirus is AIDS, acquired immune deficiency syndrome. It is called as syndrome because the virus load, when it is increased in the blood stream, that produces the inflammatory and damage to the multiple organs of the body, and there are clusters of symptoms appears. So it is not termed as a disease, but it is a collection of the symptoms. So due to involvement of the multiple organs, it is termed as syndrome. Collectively, and in few words, we can say it is the damage to the immune system of the body by this virus. That is why it is called as human immune deficiency causing virus. And this virus cannot be destroyed in the body to the 0 point. It still live in the body, in the bloodstream, but the virus load can be decreased up to that point where the person which is HIV positive cannot transmit this syndrome to the healthy ones during sexual intercourse or the in various other procedure, that is the vertical transmission. Pregnant mothers cannot transmit to the neonates. So when during pregnancy the test for HIV, this retrovirus is compulsory. So when it is detected that the pregnant woman is positive one, immediate start of the antiretrovirus drugs should be started so that to save the neonate from this infection. Now, when it enters in the T cells, it damages the T cells, it grow on the protein produced by the T cell, and increase in virus load is produced. Millions of the virus they are produced. They spread via bloodstream to the various organs that damage them, produces inflammatory processes. So the symptoms produced, they can be divided into three phases. First phase is acute one, second is chronic, and the final result of this hazardous infection is the AIDS one, acquired immune deficiency syndrome. So in acute stage of this infection, that is entry of the virus, that produces symptom after a period of 2 to 4 weeks. This is the incubation period. The symptoms they are produced is the fever, headache, malaise, lethargy, myalgia, arthralgia, and the other symptoms, the inflammation produced in the brain, that is encephalitis, endocarditis, enlargement of the liver and spleen, and overall the most or the hallmark is the enlargement of the lymph nodes of the various group in the human body, lymphadenopathy. Overall, all the groups are involved by this retrograde virus. Second phase is chronic one. It is a prolonged stage. That is, it may pass up to 10 years or more than 10 years if it is not treated one. So during this, there is chance for the production of various other diseases due to the immune system has been decreased one, that is the in bloodstream T cell CD4 cells count is lowered, and the anti retrograde, the retrograde virus of this infection is increased one. This is called as the virus load is increased one. So due to this imbalance, the defense system is damaged, whereas the infection is superseding one, empowered one, due to which the various organ they are involved and produces various symptoms one. The final, the phase is the AIDS one. So at this stage, which is very agonizing, very miserable ones and very dangerous one, there is lymphadenopathy, and in this stage, in phase, there are opportunistic diseases. The other various other diseases or the various other pathogens, they produce the different other diseases like TB, pneumonia, COPD, then toxoplasmosis, then there are sarcoma, lymphoma, and the cervical carcinoma. These are various produced by the other pathogens which are get entry in the body because the defense system has failed to attack or destroy these pathogens. So the other diseases they also come into play, due to which the life of the person is endangered. So early diagnosis, early treatment with the anti-retrograde virus treatment is compulsory one to save the life of the patient. Patient suffering from HIV positive one can lead a very happy and very the full of activity. He can perform his functions one and a very comfortable, cheerful life, provided the medical treatment and the diagnosis is early diagnosis is compulsory. So these are the now we can divide